The port delivery system was shown to be effective for wet AMD treatment. What did the PAVILION study find when it came to treating diabetic retinopathy out to 100 weeks?
I'm Scott Kraswanis, that is Greg Notstein, and you are listening to New Retina Radio from Retina Today and Bryn Mawr Communications. I sat down with Dr. Margaret Chang at this year's ASRS meeting in Stockholm. She reviewed her podium presentation assessing the 2-year safety and efficacy data of the PDS in patients with diabetic retinopathy who do not have DME.
Plus, Dr. Chang offers her opinions on what it will take for retina specialists to trust the PDS now that the next generation model has been released. Hear what she has to say in this one-on-one interview.
The PDS is back. Genentech has reintroduced the Susvimo ocular implant for wet AMD after the product underwent design changes, including a new septum overmold bond that should lead to fewer cases of septum dislodgement. Research continues in other possible indications, including diabetic retinopathy, which is under investigation in the PAVILION study. Dr. Margaret Chang is here with us in our mobile studio in Stockholm to talk to us about PAVILION's 2-year data readout. Dr. Chang practices at Retinal Consultants Medical Group in Sacramento, California. Dr. Chang, welcome to the show.
Thank you so much for having me.
Let's start at the top. Tell us about PAVILION's design.
Yeah, so PAVILION was a phase 3 trial designed to evaluate the safety and efficacy of the PDS that was refilled every 36 weeks. And these were patients who were treatment naive with moderate to severe non-proliferative diabetic retinopathy and no clinically significant macular edema. And so patients were assigned 5-3 to the PDS arm or a control arm, and the primary endpoint was at 52 weeks, and it was the proportion of patients improving 2 or more steps of DRSS at week 52. So the data I presented this year at ASRS is the 2-year readout of PAVILION.
Okay, so we'll get to the 2-year readout in a minute. Let's talk about the study arms. What did the PDS arm look like?
So in the PDS arm, patients did receive 2 loading doses of Ranibizumab and followed by the PDS implantation at week 4. They then were followed monthly and underwent refill exchanges every 36 weeks. Now, if an investigator determined that the patient had developed clinically significant DME or vision-threatening complications such as proliferative diabetic retinopathy or anterior segment neovascularization, the patient could be given a supplemental Ranibizumab injection.
And then tell me about the sham arm.
So in the sham arm, for the first year, they underwent clinical monitoring every month. And again, they could receive supplemental Ranibizumab for DME or vision-threatening complications. But at week 60, these patients crossed over and received, again, loading doses of Ranibizumab followed by a PDS implant at week 64. They then received refills every 36 weeks.
So the study met its primary endpoint, which was at week 52, and that showed that the PDS dosed every 36 weeks was superior to sham. What did you find at week 100?
So at week 100, we found that the improvement in DRSS that we had seen at week 52 was maintained all the way through, and that 98% of PDS patients did not require supplemental injections. None of the PDS patients developed PDR or ASNV during that first year of the study, and only 2% developed these during year 2.
And what about the patients who crossed over, the ones who received the PDS after year 1?
So these patients as a whole showed a remarkable and rapid improvement in DRSS after crossover. So in the first year, 21% of them developed PDR or ASNV during that first year of the study when they didn't have the PDS. And after crossover to PDS during year 2, none of them actually developed PDR or ASNV afterwards. Also, none of these crossover patients needed a supplemental Ranibizumab injection through week 100.
That's pretty impressive, but still there's a cloud hanging over the PDS and its safety. The device was voluntarily recalled after reports of septum dislodgement, and I know that the device underwent a redesign. Were you guys using the redesigned product here, or was this the original design? And what were the safety findings in PAVILION altogether?
So the PDS implants in the PAVILION trial were indeed part of those original phase 3 implants that did have the septum dislodgement issues. So the newly redesigned PDS and siliconized refill needle will only improve the longevity of the PDS that is implanted in the future.
Sure.
In terms of safety signals, there weren't any new safety problems in PAVILION. The updated safety analysis was consistent with the primary analysis. And the rates of endophthalmitis and conjunctival issues were really lower in this study than in previous studies of PDS and neovascular AMD. And I think that some of that can be credited to some of the improvements in surgical technique that have happened over time.
Is that just due to surgeon comfort, or was there some change to the protocol?
No, there were multiple iterations of different protocol changes or instructions for use. And I think that PAVILION, being the latest phase 3 study, really had the full benefit of all of these changes.
Oh, I see. Okay. Now, these data are impressive in a vacuum, but there are still going to be surgeons who are reluctant to use the PDS given its history. What do you think your colleagues need to hear in order for a wider adoption to occur? Is it real-world data? Is it longer clinical data? Is it specific leaders adopting the device and talking about it? Like, what really moves the needle here and gets trust back in the PDS's corner?
Well, I think that the incidence of complications is always higher for a new surgical procedure or device, and it always takes more familiarity with the device and the technique for more widespread adoption to occur. So a lot of people will want to wait and see before adopting the PDS procedure, but I think that the PAVILION study really gives compelling evidence that long-term diabetic retinopathy control is achievable with infrequent refills, and that these patients who are at highest risk of sight-threatening complications can really benefit.
All right. Well, Dr. Chang, thanks for coming on New Retina Radio and telling us about your ASRS talk.
Thank you so much for having me.
That's a wrap for episode 2 of our ASRS 2024 coverage. Thanks for listening.
Be sure to listen to this episode and future episodes on your podcasting platform of choice. Make sure to share and also download and subscribe as well.